Awesome, thank you. Let me share my screen. Can you see my screen? That's always a trick question. There's no screen being shared. Oh my goodness. Have you finally got up to my trick?
You've overused it, so please come up with new tricks.
You have to ask like twice, like, what about now? I'm like, we still can't see it. Like, really? Okay, let's try again. Meanwhile, you are creating the slides. Yeah, that's a trick. But please don't use my trick, okay?
I'm not falling for it ever again.
Okay, all right. How about now? Oh, where's my
We can see it, sir.
Oh, great.
Yeah, thank you. The slides are beautiful.
Oh, okay, awesome. All right, okay. All right, now how about now?
I think we see it, but you're showing the wrong screen.
It's the wrong screen.
Mm-hmm.
Can't you see trends and associations of mental speaking? Okay. All right. So today I just wanted us to like go over in practice some of the things that we need to pay attention to when analyzing trends data. But more importantly, I wanted to see if people had questions or if people are working on anything that has to do with trends so we can answer the questions. So today's session is going to be very interactive. So if you have questions, if you're working on anything that has to do with trends, I'd like you to share it so that we can discuss it so others can learn from it. And then after I've taken your questions, then I would review the case study here to see some of the things we can learn in terms of presenting trends data and some do's and don'ts, right? But first of all, I want to see if people have questions in terms of anything that's to do with trends or time series analysis. So the question is, are you working with data that has to do with time, like pre-posts or anything of that nature? And what are your questions in relation to that? So today's session is just purely Q&A and then looking at this case study. Okay, so no one is working on trends data? That's surprising. They're always working on trends, on changes over time. So why is nobody working on trends? Is it that there's no interest in trends, or is it that you just don't know where to get the data from? Like, yeah, oh yes, there's a hand.
Maureen?
Okay, I'm actually working in trends, and that was part of the question I asked yesterday. I'm working with COVID-19 data sets. So I'm actually looking at the effectiveness of non-mask intervention on COVID-19 outcome in Canada. So it was part of the challenge I was having was part of the question I asked, being able to, because the research question I'm looking at is to know, let me just read it how I wrote the research question. So the research question I'm looking at is to assess the sub-provincial effect, like, you know how Canada have 6 big provinces. So, but most of the work have been done on the provincial level, but I want to look at like the sub-city, sub-provincial level, the city level, to know if the effect that was seen in the bigger province is replicated, or is it what is, because when the North Mexico intervention was implemented, it was actually at the province level. So my work is trying to see if the effect of non-pharmaceutical intervention, to know how effective it was at the city level. Then the second thing I was trying to look at is to know which of these non-pharmaceutical intervention was most effective in reducing number of COVID-19 cases or death. Then, like, in which location, that's what are the regional contexts that made it more effective. Maybe within a city, here was more effective than another city, trying to check if there is anything, maybe population or something that made that difference. So that's me.
All right, that's great. So let's dissect that question, right? So there are two aspects to that question. One, you said, is are the effects seen at the large level consistent or also visible? Let's put it very, very simple, no big words here. Also visible at a small level, right? So we have a very big level, which is the provinces, or the very big level of governance, maybe the second administrative units. So we're now looking down and saying, oh, do we see something down there? The effects we see up, do we see them down, right? Then number two, you are asking which of the interventions is more powerful. Again, putting it very simple, right? So here you're saying you have a bunch of interventions that were implemented, and the question is, of all of them, which is more powerful? That's putting in a very lay term, but in other words, we're trying to see, the comparative, effectiveness of one intervention over the other, right? So as usual, we always try to evaluate research questions with the PICO framework, right? The PICO framework always gives us a framework through which we can break down our research questions and look at them in a way that is answerable. Because we can come up with questions very later, but in other words, we're trying to see, the comparative, effectiveness of one intervention. I'm not sure what that was. Okay. Look, please, you can take over the class. All right.
Apologies.
That's fine. So PICO, right? So P, what's P in PICO? This is going to be interactive class, please. So we're a few of us, so let's make it interactive. What's the P in PICO? Yes, Maureen. Okay. Well, you're muted.
You can unmute yourself, Maureen.
Population.
Excellent. So population. What of the I?
Intervention or treatment.
And then the C.
Comparison.
Exactly, comparison. Very good. The O.
Outcome.
Outcome. Excellent. The T.
Time.
Excellent. And the S. Okay, study design. Okay, let's start with the last. What kind of study design is this? Let's start with the S.
Is it ecological?
What is an ecological study? Maybe when you define it, then we can determine whether it is or it is not an ecological study. So what is an ecological study?
I think ecological study is study about like geography, the locality, how these studies about the city, the province. Yeah, that's my understanding.
Yeah, your understanding is very close to it. But we just need to add a bit of nuance. Who wants to add the bit of nuance that is needed to make it 100% accurate? Why is it called ecology? When you think of ecology, you think of wildlife, you think of forests, like massive areas of geography. Like you said, you mentioned the word geography, right? So obviously here this is epidemiology, this is not geography, right? But what about that is parallel or is aligned with the concept of ecological studies?
In ecological study, the units of measure is not like the people, is related to the like a population base. So is there like an environment or a country or a county? So the unit is not what is synonymous to the population is not what's synonymous to population is the units of their location, rather than just maybe age or gender or maybe any observation you're trying to identify. So I think that's
Excellent. You're right. So when we're doing analysis, there are two things we want to pay attention to. The first is unit of sampling, and the second is unit of analysis. Now let's see how they're different or they're related. Let's say that I'm a dentist and patients come to the clinic. I select certain patients and I'm interested in the number of teeth that have caries. So I select 10 patients and then I look at, on average, of all the patients sampled, an average of 5 teeth have caries. Now in that scenario, what's the unit of sampling?
So in that sense, the unit of sampling should be the ecological areas like local governments or states.
Okay. No, but I'm talking about the illustration I just gave now. I go to dental clinic, I select 10 patients, and then among these patients, I calculate the average number of teeth that have a hole in them. What's the unit of sampling and what's the unit of analysis in that case study? The unit of sampling is what did I sample? So in this case, what did I select?
I think the unit of sampling will be patients that use that clinic. The unit of analysis will be presence of the caries in each of the patients that you have sampled.
Exactly. So in this case, the unit of sampling is the individuals, right? The unit of analysis is the tooth, right? So my data set could look something like this. So in any analysis you're doing, I think sometimes we get carried away with the complicated terminology, right? These are the fundamentals that we really, really need to understand. So let's open a spreadsheet and let's see how that could look like. So, sorry, let me open the spreadsheet quickly. So I could have something like this for person 1. I have tooth number 1, tooth number 2, tooth number 3, and so on and so forth, right? So for this guy, does this tooth have caries? No, no, yes. Person number 2, yes, 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 right? So at the end of the day, I might end up with a scenario where I have a single variable called tooth, and then I am looking at the variables. I have something like this, where for the first person, and then I have this. So when I say average of all of this, I say, on average, 0. The average number of teeth with caries were 66.7% of all examined teeth had caries. I'm analyzing the individual teeth, but the unit of sampling was the person. I selected the individual. I say, person number 1, come here. The guy comes and I check his mouth and I check each individual tooth, so in this case, it's very clear that the unit of sampling was the individual, but the unit of analysis was the tooth. In many cases, the unit of sampling and the unit of analysis is one and the same. If I selected individual number 1 and I'm saying, hey, do you smoke? And they said yes, or they said no. In this case, the unit of sampling is the individual. The unit of analysis is also the individual, right? So when you're doing any kind of analysis, your job is to first of all know what is the unit of sampling and what's the unit of analysis. They could be the same thing, they could be different things, right? And in issues of healthcare utilization, we typically look at things like number of healthcare visits, right? We might be interested in, on average, X visits were characterized by so and so. In that case, one person might have multiple visits, and we're looking at the visits overall as a unit of analysis. And let's go back to our topic. Why does this matter here? When we classify studies as ecological studies or cross-sectional studies, it is very important what is the unit of sampling. In cross-sectional studies, the unit of sampling is the individual, for example, whether it's a human being or an animal or whatever it is that is of interest to us in the analysis. In ecological studies, the unit of sampling is not the individual. As Maureen said, Maureen used the word geography and Deborah used the word places or, ecological areas. Both are correct. So in ecological studies, the word ecology is there because think of an ecology as a landmass, right? We're using a landmass as a unit of sampling. So we're saying, for example, Boston or Atlanta or Lagos, right? Those are the units of sampling, right? So in this case, the unit of sampling is not an individual, right? That's why it's called ecological studies. And that's why we have what we call ecological fallacy, right? Who has heard of the ecological fallacy? What does it mean? That's a term which people mention all the time. We need to know what these things mean. These are the basics of epidemiology. What is ecological fallacy? First of all, what's a fallacy? That's a very big word. Who can help us break it down? When we say fallacy, what does it mean? In simple terms. Yes, Princess.
Please, fallacy means false. Yeah, something that's false.
So a lie, essentially, right? So a fallacy is a lie.
Yes, it's a lie.
Excellent. So what is the ecological lie?
When you're assuming that the characteristics that was ascertained in a group is true for every individual members within the group.
Okay.
Sometimes make an inference and it's an ecological inference. It doesn't mean that all those inferences apply to every individually in that group. So
Okay.
there could be individual level differences that is not expressed in the ecological assumptions or characteristics that is identified. So that's fallacy when you make the assumption that it is true for everybody individually.
Okay, that's great. So in other words, what we're saying is that the unit of analysis and the unit of interpretation must be what? One and the same, right? The unit at which you analyzed and the unit at which you interpreted the results must be one and the same. In other words, if you analyzed at the level of individuals, your inferences must be at the level of what? Individuals. So because they have to be the same, right? They must be one and the same. They must be, right? If my analysis is at the level of individuals, my inferences must be at the level of individuals. If my analysis is at the level of groups, populations, then my inference must be at the level of what? Population. So what happens when you analyze the data at the level of populations, but you make your inference at the level of an individual? What do we call that? You analyze a group, but you make an inference not to the group, but to an individual. What do we call that?
I think that's the ecological fallacy that you talked about.
Exactly. So you say, oh, wow, this country has the highest rate of, let's say, terrorism. Or this country has the highest rate of, let's say, fraud, internet fraud, right? That was done at the level of the population. And then you see an individual and you're like, oh, wow, you must be a fraudster, right? The analysis was done at the level of the group. The inference must be limited to the level of a group. But now you see this poor guy and you're making an inference to the level of the individual. That's wrong, right? That is what we call the ecological lie. It's a lie because your inference should have stayed at the level of a group and not to the level of an individual. But now it's a lie because you have shifted the inference from a group level to an individual. The same thing also applies. You did an analysis at the level of an individual, and then instead of limiting your inference to individuals, you're now making it to the level of a group, right? You analyze two people that had, let's say, obesity rates, right? Just 3 or 4 of them. And instead of limiting your inferences to individuals like that, you say, oh, wow, all Americans are obese, right? No, that's a problem now because, your analysis should have stayed. That's what we call hasty generalization, right? You are generalizing way beyond that group. So either is wrong. Analyzing individuals and generalizing to the population, or analyzing the population and generalizing to a group, both are fallacies. Now, why did we come down this rabbit hole? We came down here because what we're interested in is establishing that, first and foremost, when we're analyzing data, we must establish what is our unit of sampling, and what's our unit of analysis, and what's our unit of inference. Now, your population, you said these were individuals who received, and Maureen, you said these were individuals, right?
Yeah, like it's not how normally each country did.
Okay.
Okay, and it's like how each country recorded the outcome of COVID-19 confirmed cases. So like you have COVID-19 confirmed cases for each of these units, like every day, the daily record of how many people have COVID for that day. So that's like my outcome data set.
Yeah, but in each country, what you said, how many what? How many people, right?
Okay,
In
the country, they have like 6 provinces, but within that provinces, I'm looking at the city, which is like 99 cities.
Yeah, we're interested, right? In your data set, when you look at the data set, each row represents who or what?
Okay, each row represents the daily confirmed cases of COVID-19.
Okay, but on row number 2, what does that represent? Is it a person? Is it a place, or what? What is it on row number 1 or 2 or whatever row?
Okay, it's a person.
Exactly. That's how you know your unit of analysis, or at least units of sampling, right? What is each row representing? So in this case, each row represents a person. So what kind of study is this? Do you still think it's an ecological study if each row represents a person?
Well, the thing is like the data set is like you have the dates, like today's date, you have number of confirmed cases, then you have the location, the population of that location. So it's individual, but it's not really, it's like an aggregated data. It's not like an individual. I don't know how to explain it.
Yeah, I understand you. But my point is that if each row represents a person, then it's no longer ecological.
Oh, okay.
Because Morales said ecological means that the unit of sampling is higher than the person. That means that if it's an ecological study and we open our data set, what we'll be seeing will be that row number 1 might be something like Accra. Row number 2 might be Lagos. Row number 3 might be London, right? But that's not what you're seeing here, right? You're seeing, in your case, row number 1 is Mustaq, and row number 2 is Bello, right? And row number 3 is, Amir. Those are individuals. This is different from this. This is ecological. This is not ecological. Do you understand? Yeah, Maureen, go ahead, please.
Okay, yeah, my data set, row number 1 is like the first one, like you have Accra. Then in Accra, they'll have number of confirmed cases will be like 3. So you have Accra, you have today's date, you have Accra, you have the number of confirmed cases, then you have the population of people in Accra. So that's how it is.
Okay. Alrighty. Sounds good. So now we'll come back to that, but remember that in this case, what you have are the counts, right? So here you have, for example, you have the counts of individuals. So here, what you're saying is that you have Accra, and then you have 4 people, and then you have 7, and then you have 8, right? Now, this is a data set that was now aggregated and sent to WHO. But you have to think back to the data set that was there before the one that was aggregated. In the non-aggregated data set, you didn't have Accra 4. What you had was Accra. What Accra sent to WHO was something like this. You have Musa. He came on the 1st of January. He had this temperature. And then you have Amir, right? This is what was then aggregated and then sent. So what makes the study a particular type is not the aggregated data itself per se, but what the original data set was, what was sent originally. So in this case, this is no longer ecological, right? Because the original data that formed this summary had individual level inputs. Think of it, right? When you go to take a vaccine or to get a COVID shot, they are collecting your data. The person at that office collects your temperature, collects every detail about you. That is what is going into that database that is then aggregated to have something like this. So when we have a data set like the COVID, what kind of study design is that? Like a COVID vaccination, you're going to get the vaccine and all of those things. What kind of design is that? The hint, it starts with the word case. Who can complete it for us? Any takers? No, it's not case control. What other cases do you have? No, case report is a study of one individual. One single study, one single person makes a case report.
Yes, sir.
Case studies.
Case cohort. Case cohort.
No, case cohort is the type of case control study. Aha.
Case study.
It's a case series. That's very important, right? It's a case series. Now, a case series is a very, very important kind of study in time series analysis. In fact, the two words are aligned, right? Time series and case series, right? So what is a case series? Well, and tell us what a case series is. Because we need to understand the designs before we can understand all these other things. If we don't understand the study designs, then we can't understand every other thing that follows. So what is a case series? And how is it different from a case report or a case control? Yes, I do say.
Okay, so a case report is about a single case that you are writing a description about a particular case. And then a case series is the same diagnosis but different people, but they don't have any relationship between them.
Okay.
And then
go ahead, please. Yeah.
And then the last one is case control. That is where you have a case and you have another selected group called control. They have the basic characteristics except the object of interest that the control doesn't have, or the exposure of interest that the control doesn't have.
Okay. All right. Let's look at. Thank you very much. Great. Great work. So we have row number 1, right? On January 1st, we had a guy come with COVID, right? We're talking about COVID. That's the context for our study now. He had symptoms of COVID. And we collected his information in our data set, in our Excel spreadsheet. Let's call him Mr. Amir, right? Right. We know that this is his name. His symptoms, we collected them. He has a fever. We know that, the date he came was, January 1, 2025. What kind of study is this? This is the only guy we have information. This is the only information we have in our data set. What study design is this?
Case report.
Excellent, case report. The next day, somebody else came. Let's call this Sandra came. I hope there's no Sandra here. She has nausea, and this was on January 2nd. What kind of study design has this become?
Case series.
Exactly. Case series, right?
Case series.
Case series. So case series is we have a data set. So now we can now have this for number 1, number 2 to number 1 million, right? Different individuals who come. What unites all of them? If I might ask, what is the common denominator between all the people in this data set?
They all have COVID-19.
COVID.
Exactly. So a case series is a bunch of reports that are united by either a common exposure or a common outcome, right? And that is what fundamentally makes a case series different from a cross-sectional study. In a cross-sectional study, we sample people independent of exposure in general, right? But here, everybody who comes to our data set has either COVID, whatever we're interested in, whatever the common exposure or the common outcome is, right? Everybody in the case, is united by having that either common exposure or common outcome. That's what makes a case series. So we don't want to confuse case series, case report, or case control. Now, a case series is very important in analysis of case or time series data, because now we have all these people. Some came on some dates and some. So if we extended this very, very indefinitely, we'll have a scenario where we have all these individuals who came in our data set on very different dates, right? And now we have, let's say on this date, we had an intervention, right? The question then is, the count of, and remember that it's not just Sandra that came on this day, right? We're now aggregating the data so that we now have day 1, day 2, day 3, and on day 1, we knew we had 3 cases, we had 5 cases, we have 7 cases. Now, this is the kind of data that Maureen now has that is aggregated by day, right? And then we have all this all the way down to the end. So we know that this is when our intervention was done. So Maureen is interested in knowing, does this intervention work, right? Again, big picture, we have a case series data where we had COVID-19 or whatever the outcome was collected across different days, and now we have an aggregate of count, right? So here, the variable here, the type of variable here is, what type of variable is this? On this stuff, what? Ignore the decimal places, right? What kind of variable is this? 3578. What type of variable is that? Is it categorical? Is it numeric? Is it count? What will you call that?
Numerical.
So numerical. So there are different types of numerical, and specifically, what type of numerical variable is it?
Count.
Exactly, count. So this is a count variable, right? So most times we're dealing with time series data, we're dealing with counts. In other words, on this day, how many people had this condition? We're counting 1, 2, 3. So 3 people on this day had this particular outcome. So what we're interested in essentially is to know, is this count, are we getting better or are we getting worse? Which is a very reasonable question, right? If we have an intervention, we obviously want to know that we are doing better. Because in every outbreak, our goal is to drive the outbreak to 0, right? whenever we're doing major outbreaks, well, let's say, oh, geez, how do we get to zero? In other words, how do we get a count of people who have the confirmed disease to zero? That's the goal of any outbreak response, right? Getting to zero. We want to drag that count to zero. So we have interventions done on this day, and we're trying to see, does it work? Obviously, we care about whether it works, because if it works, we want to replicate that same success story elsewhere, maybe the neighboring villages, or we want to document it in the New England Journal of Medicine so that other people elsewhere can do it. Or the next time we even have that same outbreak, we know how to respond. It's no longer new. We know how these things work, right? That's why we're interested in knowing it. So now let's go back to Maureen's question, back for a second. So we said that for us to answer these questions, remember, we're taking a step back. We said we have to understand the PICO. We have to frame the study in PICO. So whenever you have a study, before you make sense of it, it's best for you to frame the entire research question in PICO. So get a paper or a napkin and just write down the elements of PICO. What's my population, the intervention, the comparison, the outcome time, and the study design. That brings clarity to your thinking so that you can answer the question effectively. So we've established that this is the study design. The time is the period from the first, this day 1 to day 35, right? We want to make sure that we allow sufficient time before. The time is very important because you want to make sure in general that there's balance, right? Whenever we're doing statistical comparisons, we want to achieve balance. Balance means that the sample on the left-hand side should be equal to, it doesn't have to be exactly equal to, but it should balance the one on the right-hand side, right? So here, we want to make sure that we have enough observations before and enough observations after. That's why it's important. Imagine that you have a whole stretch of interventions, days. So let's look at the very extreme case. You have day 42. Somebody has all these days, and then they implemented intervention on this day, and then you are coming to see, oh, geez, does this intervention work on day 42? That's not reasonable because, one, it takes time for an intervention to work. You don't just implement something yesterday and say, geez, let's find out today, right? And here you don't have enough, you don't have enough balance in the groups. So that's where the time is important. When we talk about the time, it's important because in the time series analysis, we want to make sure that we have sufficient observations in the before as well as in the after. There has to be some balance, right? Because statistically, we optimize detection of differences when we have a balance in the two groups. Usually when we're looking at interventions like, oh, exposed and non-exposed, we're looking at individuals. But here, in a time series, it's now the days, the durations each day that makes up the unit of analysis, right? We're looking at all these days before versus all these days after. So we want to make sure that we have enough balance in the two groups. Otherwise, we will not be able to detect any difference in the pre versus the post, right? That's why time becomes very important. So that's why this is important. So we've talked about study design and time. The outcome here is straightforward because, again, in the case series, everybody has a common exposure, the common outcome. So in this case, we're looking at everybody with COVID-19. So that's pretty well-defined. But we need to still worry about the outcome because the question is, how was it measured? Was it measured by self-report or was it measured by, for example, lab assessments? Now, why is that important? Why do we care, whether individuals there were captured by self-reports versus in a lab? From an epidemiologic angle, obviously. Why is that of relevance to us? Or put in another way, right? The assumption is that everybody in this data set has what? if this data set is one to capture individuals with COVID-19 and their symptoms, right? And we're trying to see how interventions, affect the incidence of new cases, so development of new cases. The basic assumption, obviously, is that everybody in this data set has COVID, right? So when we go back to the outcome, how we capture the outcome, whether by self-report or by lab, is important for the simple reason of what?
Maybe self-reports might not be for accuracy. Maybe the person just said it, but not so sure. But lab, we are sure that this is it.
Excellent. So it's for the issue of misclassification, right? So we don't want misclassification. So that's why we want to make sure that there is no ascertainment bias, that everybody's measured exactly the same way. So that's why we care about how things were captured, to avoid ascertainment bias. All right. So now here is the crux of the issue here. This is where Maureen's problem starts: the intervention and the comparison. Now, from a scenario Maureen printed yesterday, if the intervention was done on day one, let's say that you are in a country where they never had COVID-19 cases, but they have been observing other countries have COVID-19 cases, right? So they were prepared. On day one, right from day one, they implemented interventions. Can you then compare the impact of intervention just by using that data set? Remember that right from day one, we implemented interventions, right? What's the problem here as far as comparative analysis? And you can contrast this with this one here.
There's nothing to compare with.
Excellent. There's nothing. You have no comparison, right? Here we had the bad days, and we can compare them with the good days where we had intervention. Obviously, I'm just using bad and good in a very simplistic context. But here, right from the word go, everybody was exposed. If everybody was exposed, that means that we don't have a comparison, right? So if we're going to have a comparison in this context, what could we use? Let's say you really, really want to have a comparative study, right? What are your options here? Yes, Maureen.
Okay, the options I'm looking at is, let's say, for instance, in that country, if there are, maybe because you have many cities, if there are cities that implemented earlier than the other, but they have similar, maybe geography, similar population or something, that's the option I'm thinking about.
Excellent. So here you were saying that we have this country, this massive country, but in the different regions do not implement it at the same time, right? So here, what are we comparing exactly then? So let's say that this is one region, they implemented it first on day one, right? Then the second region implemented on day two on a very different date. So this is region 1, region 2, and then we have region 3. Ultimately, at the end of the day, all 3 regions implemented interventions, right? Let's say this one, month 1, this one on month 2, this one on month 3, right? So what will be how will you compare this then? Because this is what you just described now, Maureen, that you have a scenario where different districts or regions implemented it at different points in time. T1, T2, T3, right? So what could you do?
What I'm thinking of, which I don't know if I do, is like, for instance, if the T1 implemented on, let's say, 1st of January, and T2 implemented, let's say, 5th of January. So looking at, and they have like the same exposure. So looking at maybe what happened in T1, let's say between that first to fourth, what happened in T1, comparing it with the first to fifth of T2, when they have not implemented that intervention, to be able to compare if what happened in T1 is actually due to the intervention or just so like the result, to know if the results from that T1 that started from that 1st of January is similar to what is obtainable in T2 from the 1st of January, because at that time they didn't have the intervention in place.
Okay. All right. Let's so let's make it more visual so we can all follow, right? So we have 3 cities here. Let's draw them very clearly. This is the first one. This was exposed right from the word go. This is the second one. At this point, was not exposed. And this also was not exposed during this time. So that's what we have at T1. Right. At T2, we have something similar. Let me copy this. And let me paste this also. So at T2, we have, this is now exposed here. And this is not exposed. And then at T3, oh, geez, my computer is hanging. Okay, let's see. Go back. Sorry about that. My system is having a glitch. Oh, okay, good. I'm not sure why it was glitching, but anyway, that's fine. So at T3, all are exposed, right? So this is like a visual summary of what Maureen just described. So it's kind of like a step wedged where everybody's ultimately exposed, but they're exposed at different periods. So in this case, what we could do is look at it, compare duration exposed versus duration non-exposed, right? So what does that mean practically? So we have our data set here. Mr. Number 1, person number 2, number 3, and number 4. So we have the guy comes from city A, city B, city C. So when we're classifying the duration of exposed and non-exposed, we're going to look at where they live, right? Number A guy comes in city number A, which was exposed right from the word go, right? So we're looking at the duration under which they were exposed, right? So at this point in time, this individual was exposed to intervention. This one wasn't exposed, and this one wasn't exposed, right? So here we can look at the rates. So at this point, we're looking at rates. What's the total amount of time in which an individual was exposed, and what's the total number of time an individual was not exposed, right? And that allows us to be able to come up with a measure and say, during the times when people were exposed, how many occurrences of COVID-19 did we have? And versus during the times when people were exposed, right? Because then there's an element of time where we have to capture the time too, right? So that's one way we can do that, right? Alternatively, we can also say, instead of trying to calculate this, we can also compare to a neighboring city. So imagine that we had exposures all on the same day. We can look at another city that was not exposed and say, well, we implemented intervention from day 1 here. But we're going to now compare to, so this is the day we implemented it. We have another city right beside us that had no intervention at any point in time for whatever reason. So we're going to compare our population versus their population, right? What do we call this kind of study, by the way? Okay, have we heard of the term quasi-experiment or quasi-experimental study? So this is what we mean when we talk about the quasi experiments, right? The word quasi means like kinda. It's like kinda an experiment, because in a true experiment, we, the investigators, randomize a group to being treated, and we randomize another group to not being treated. In this case, we just assign treatment to one group, but we have no control over the other one. Remember, it's not us that decided that these guys should not be exposed. They, for whatever reason, were not exposed, period. But we're just taking advantage of that, right? That's why it's called a quasi experiment. Quasi comes into place because we, the investigators or the policymakers, implemented treatment on this whole population. But remember that an experiment is two arms, it's not just one arm. On the one arm, people receive treatment. On the other hand, people do not receive treatment. And we compare this group versus that group. In this case, it's a bit different because, of course, this one group received treatment through our intervention over the whole population. But this other group, true, they did not receive treatment, but that was not through our hand. They did not, so it's like half an experiment because only one half receives, but the other one that did not receive had nothing to do with our study. We are just using them as an advantage, right? So this is how we can also compare and say, okay, well, compared to this group, this is it, right? But what are some of the limitations of this approach that arise from the nature of assignment? Is, first of all, is this, you know, remember that this is an observational study, right? This, we just pick a group that that happen to match whatever criteria we have set. And so what are some of the limitations that could arise, or biases that could arise from our selection of control? What do you think? First of all, are we clear with this, the setup of the quasi experiment here? Is anyone confused about that? Okay, we're suddenly very, very quiet. Okay, I'll assume that it's clear. All right, so now let's look at one of the assumptions for causality, right? To understand some of the limitations that could accrue from the use of this methodology. Remember that whenever we do analysis of a causal nature, there are certain assumptions that we have, right? One is that there's well-defined interventions. There is no measurement error. Very importantly, number three, extremely important, there is exchangeability, right? There is positivity. Now, let's focus on one. Let's just focus on this one. This is the most important assumption for causality in this context. What is exchangeability? What do we mean by exchangeability? From the word, just the English language, right? Let's not think about the complex meaning. When it says exchangeable, what does it mean? Who knows what a trade by barter system is?
Give and take. Like you give something in exchange for something.
Okay.
Yes.
But yeah. So like, who can tell us trade by barter? How does it work?
It's an exchange of goods in exchange of goods.
Okay. Now, what's the premise? Why does it work? Like, for trade and barter to exist, what must be present? What's the underlying assumption in trade and barter?
Two different goods.
Okay, but the goods, I give you something and you give me something. But what's the assumption? What's the implicit assumption on the underlying trade and barter, trade by barter? That it's the good is changing or what?
The assumption is that one person has a good that another person also wants. And
Yes.
the first person also desires the good that the other party has. So
Okay.
then we can.
Okay. Now, let's say you have a car and I have a pot. Like, can we exchange? Is it reasonable to exchange a car
The
for?
value,
Yeah, go ahead.
the value has to be the same. It has to
Excellent.
be of the same value.
Excellent. So in other words, we are saying that the assumption that there must be what? Look, based on what we have on the screen here, there has to be what?
Exchangeable.
Ability.
Excellent. There has to be exchangeability. Like it's ridiculous to imagine that somehow I should give you a car and then you are going to give me a biscuit. It's like, really? Like, in what world do you imagine that a biscuit is equal to a car? They are not equal, right? So exchangeability means that the two groups should be equal in every other way except the exposure. That the only thing that should be different between them is that one group received treatment and the other group did not receive treatment. Every other thing must be exactly the same between them. That is what exchangeability means in epidemiology, right? It means that the treated would have been like the untreated if they had been untreated, and the untreated would have been like the treated if they had been treated. Right? Every other thing is exactly the same between these two guys. Now, is that realistic in the real world? You pick population A, community A, and then you pick community B that did not receive treatment. In your viewpoint, do you think that exchangeability holds all the time in epidemiology or in studies that we do?
I think it's very rare.
Okay, why? Can you think of a scenario why that assumption might be violated very easily?
Well, first of all, I'm looking at although the whole population may not have the intervention, but because it's not like a closed population, like it's an open population where people can go in and come out. So there is still possibility that some part of the population have that intervention.
Okay, so you are alluding to here, no measurement error, right? You are saying that everybody there is truly unexposed and everybody here is exposed. So, and that's correct, right? But let's stay on exchangeability here. How could you, let's say you have two populations, right? Can you think of any ways where those two populations could be different? Like in terms of what?
Age, sex, proportion of sex, age.
Exactly. So you can see it very easily that exchangeability is a very heroic assumption that we may not be able to satisfy. Now, we're not saying that you should not do the study. We're saying that you should have a very fast limitation section where you can tell us that, oh, wow, and as a scientist, you eloquently describe the limitations that face your study, right? So you should be able to come here and say, in terms of measurement error, this assumption might be violated because, like somebody said, some people there might be exposed and some people, the policy doesn't trickle down equally. And, so we're comparing, instead of us comparing apples to oranges, we might be comparing apples to apples because the two groups might be very similar. They might be both be exposed, for example, right? And in terms of exchangeability, while we theoretically hope to see that the two groups are completely the same in every way except the exposure, this may not hold true in real life because we see that this one is older, that one is younger, this one has more money, that one is poorer. The two populations are not the same. And there's even the size. One is 10 million people, the other one is 2 million people or 500,000 people. So you can see that there's clear argument that exchangeability might not hold. That's what we want to see in your articulation of the limitations of the paper, right? But like I said, every study has limitations. So it's not saying that you can't do this. It's saying that you should know what you're doing, you should know how to describe it, and you should know the limitations that affect the study. So this is now the first part of this question. Are the effects seen at the large level also visible at the small levels? Now, this question assumes that the intervention is equally applied at the national level. So let's say you have smoking bans, or let's say face mask implemented at national level, And your question is, are those interventions also, are they effective also at, let's say, at the local levels? Well, the question is one of enforcement, right? Because if the policies is working at the national level, that means the policy works. So the point I'm trying to make here is that sometimes we want to refine our research questions to make them more novel, right? If there's clear evidence that the policy works, then it works, right? The question then here might be a question of enforcement. So your research question might be better framed as, well, evidence clearly indicates that this policy works, but it can only work if it's enforced. So we want to know whether how well this policy is being enforced, or differences in enforcement at the national level versus at the sub-level. That's one way we could frame it. Because the challenge is that sometimes we don't have as good data at the small levels as we do at the higher levels. So we need to be careful about the way we frame questions, because we might not end up having data to evaluate them. If you're looking at, for example, data on, for example, policies, we use Google. At that point in time, Google had data on enforcement and mobility and all other things that we could use. But most of those data were at the higher level, not at the small levels. So our research questions would have to be powered by the available data. So in this case, we might have to frame this more in terms of the enforcement of policies, as opposed to whether the effects are also visible, because the research question then doesn't change at all. It's just saying we are researching this question here, and then we're analyzing that same research question in this other different population. Now, regarding the second part of the question, which is which of these interventions is more powerful? Again, yesterday we briefly touched on this, and the analogy was, imagine you have a vaccine administered to an individual, right? It is very hard to say, wow, the components of this vaccine, which of them are more powerful in preventing disease? That question is unanswerable, because for us to be able to test or answer that question, we can only test one thing at a time, right? In as much as the whole vaccine was given to that individual at one single time, the only question we can ask is, does this intervention work, period? So the reality here again is, if all the interventions were implemented together, it's now hard to tease them apart and say, is this face mask that works more, right? The only way we can tell if they were implemented at different points in time. Then we can say, this one that was implemented here, or we can compare to other populations. Alternatively, we can also compare if this population, let's come back to our spreadsheet. If this population had interventions A, B, C, and this one only has A, we can kind of compare, and say the impact of comprehensive interventions versus this one, right? But this is kind of complicated because it assumes that they are only purely additive effects. But the impacts of these interventions might be interactive. So what we mean is that A and B and C may not simply be equal to A plus B plus C, but might be equal to the interactions as well, right? So in general, this question is very complicated, because in public health in general, we rarely have one intervention. We don't have a golden bullet. So that's why it becomes very hard to tease the effects apart, right? We can only do so under very specific circumstances where one was implemented and the others weren't. Then we can explore them, or we can do so in experimental settings where we can explore. But then in the real world, it's extremely hard to capture just the pure effect of one intervention. All right. Any questions? I've been doing a lot of talking before. The session was supposed to be interactive. Any questions? All right. So Maureen, do you have clarity in your research question? Are there other issues that you have? Yes, go ahead, please.
Okay. So what my issue now is that is there no way, because like what this second part of the idea behind this is that it's true that like it affect non-masculine intervention is effective at the higher level, but you're looking at it's possible that at the lower level, maybe due to the population density, the age of people, like the rural area, when in the rural area there might be tendency of having people maybe of working group or working age. Maybe the why in the urban area you have people of working class, then maybe in the rural area you have people that are more aged. And COVID-19 is affected with age and something is like coming from that sense, maybe that in this more city or more localized area, that there could be other effects that might be impacting alongside that non-vascular intervention that may not make the outcome, like its impact on the COVID-19 outcome, to be exactly the same as was seen at the provincial level. So that's like the idea behind that, because so that to be able to check if it's not really the same, what are the regional contexts or what are the things that actually impact the effectiveness.
Well, do you have data? That's the question, right? I mean, if you have data, you can explore anything.
Yes, I have data.
Okay, well then you can explore it and share with us when you've done the work on how that looked like.
Okay, all right, thank you. But I'd like to see if I can have your article on COVID-19 you wanted to share yesterday. I don't know if you're able to.
Okay, I'll pull it up and Lungli can share with the team.
Okay, thank you.
Welcome. Yeah. All right. Any other questions? If not, this class is going to be pretty short. Today was just to have a case study, and I think Maureen's research questions provide an effective case study enough, so we don't have to overwhelm.
Excuse me, sir.
Yes, go ahead. Yes.
Sir, my question goes like this. I was not able to catch up by yesterday's lecture. And when I joined today's lecture, it seems like I didn't understand anything. So what recommendation, please, what will you recommend me to do? Or if there are any sites that you can recommend me to go and watch that lecture that I missed?
Right, we share on YouTube, and you can watch the lecture from yesterday's on YouTube. So that way you get up to speed.
Okay, what are the sites? Or what I will search on the YouTube?
They will my colleagues will drop the link on the chat, so you can check the chat and access the YouTube link.
All right, thank you, sir.
Yes. Yes, Gideon.
Okay, thank you very much, sir. I have a question around, we spoke earlier that it takes time for intervention to take effect. So I just want to find out how much time should an intervention takes place before one should go on to assess the effect of the intervention. And then secondly, we have also said that in terms of the balance in the data, we should ensure we have enough balance that will make a difference. But sometimes, particularly for secondary data, you could have either more data before compared to after. So in such cases, how can one handle the situation? Thank you, sir.
All right, great. So the question of how long should you wait, there's no universal standard. It's determined by context, right? Context is king here. So, or queen, as the case might be. So, and interventions are different. If I give you an injection, the time it takes for that injection to take effect is quite different from if I pass a national law, and the national law might even be different if you say, oh, we're going to allow a 60-day waiting period before we start enforcing the law versus a policy that says we're going to start enforcing immediately. So the moral of the story is that there's no rule of thumb. It's entirely dependent on context. So you will have to use the context to determine what makes sense in your own case. The second question about balance. Yeah, truly, we want balance, ideally. But again, if there's no balance, it is what it is. But your job as a researcher is to know that if there are null findings, you should be able to explore possible reasons for the null findings. In this case, you could have a type 2 error, right? Type 2 error means that a true difference exists in nature, but our study was just unable to find it. That could result from a study that is not adequately powered. And so that could be a reason. So it's knowing that, well, in the real world, it is what it is. What we have is what we have. But you should know that, well, if I don't see a result, it could be because of this, and knowing what should go into your limitations. So that's why you need to be aware of those things.
Okay, sir. Thank you, sir.
You're welcome. Any other questions? Okay, none. Well, thank you very much. I think Lamlungile, any other comments? Otherwise, thanks, and we'll look forward to seeing you at our next session.
Thank you, Prof. Are you done?
Yes, I am.
It's too short.
Oh, really? Well, good. You can take over. I always see complaints. Oh, the session is too long. When you keep it short, oh, the session is too short. Like, what do you guys want exactly?
We want it to be long.
Oh, really? Well, great. You can pick up from here.
Thank you, Prof. Thank you very much.
All right. Thanks so much, guys. Thanks so much, everyone. Have a great weekend.
You too.
Thank
All
you.
right.
Bye-bye.
So, Dr. Ben, you can take over. Okay, the attendance has been shared.